Welcome to This Explainer. Today, we're diving straight into the deeply emotional realities of breast cancer survivorship and the data-driven science of what it actually means to thrive after treatment. We're going to be looking at some truly incredible insights drawn from clinical studies and patient advocacy groups to uncover what it truly takes to build a fulfilling life after a diagnosis. Here's our roadmap for today's Explainer. We'll cover the reality of survivorship, defining quality of life, the science of resilience, the power of support, and finally, thriving beyond treatment. Let's get right into it. Section 1, the reality of survivorship. So we're kicking things off by acknowledging a truly jarring transition that catches so many patients completely off guard. I'm talking about that exact moment when active treatment ends. You really have to ask yourself, what happens when that constant safety net of your medical team is just suddenly pulled away? For a lot of women, finishing active treatment is incredibly bittersweet. Sure, there's immense relief, obviously, but then it's almost immediately followed by this daunting challenge of figuring out how to live without the frequent doctor visits and those rigorous treatment schedules that have practically dictated their entire lives for months, maybe even years. The safety net is just gone, and patients are left looking around asking, okay, what now? Well, there's a staggering statistic from the advocacy group Faith Through Fire that reveals a really hidden struggle. 40% of cancer survivors report having unmet emotional and psychological needs. Think about that. Despite surviving the immense physical ordeal of cancer, nearly half of these individuals feel totally abandoned after active treatment ends. They are completely overwhelmed by a sheer lack of comprehensive resources to help them process that trauma and actually rebuild their lives. And that emotional burden doesn't look the same for everyone. It really depends on the patient's status. Survivors who are in remission often wrestle with this intense anxiety of recurrence. It's that nagging fear that every minor ache or pain literally means the cancer has come back. On the flip side, those in ongoing care, like patients with metastatic or chronic cancer, they face a completely different but equally heavy emotional toll. They're dealing with the constant fear of disease progression and just the sheer exhaustion of continuous treatment. Both of these paths, they require absolute immense mental stamina. Moving on to Section 2, defining quality of life. To figure out how we can actually help patients navigate these intense fears, we first need to get on the same page about what constitutes a quote-unquote good life in the context of cancer survivorship. Now, according to some really comprehensive resources from Susan G. Komen, quality of life extends way beyond just your physical health or, simply being cancer-free. It's this massively complex, interconnected web. It encompasses your mental and emotional health, your social well-being, your ability to perform daily roles, sexual function, and even the very practical realities like your financial status. Managing the side effects that impact literally any of these areas is an absolutely crucial part of a patient's long-term follow-up care. Which brings us to Section 3, the science of resilience. So let's see how all this builds into an empirical, data-driven understanding of what actually drives that quality of life we were just talking about. To figure out how to improve it, we have to look at the data. There was this fascinating cross-sectional study published recently in BMC Women's Health that looked at 218 women with breast cancer. The researchers used a statistical method, it's called path analysis, to mathematically map out the various factors that predict a patient's overall well-being. They looked at the whole shebang: age, disease stage, hope, resilience, and social support. And what the study revealed was just a truly eye-opening reality. Logically, you might assume that how advanced the cancer is would be the absolute biggest predictor of a patient's quality of life, right? But no, the data showed that a patient's actual clinical disease stage did not significantly predict their quality of life. Let me say that again. The clinical stage wasn't the main driver. Instead, it was their psychosocial factors, like hope, resilience, and support, that absolutely did. It just goes to show that the mind and the surrounding community play an incredibly powerful role in how a patient actually experiences the recovery. Okay, Section 4, the power of support. If these psychosocial factors are the true drivers of well-being, we absolutely have to examine the foundational layer of this dynamic. The data reveals what I like to call a brilliant unseen engine of recovery. The researchers literally mapped out a direct chain reaction. Step 1, perceived social support. That means actually feeling backed by your family, your friends, and your community. Step 2, that support directly fuels higher levels of hope and resilience in the patient. And then Step 3, that hope and resilience work together to generate a significantly higher health-related quality of life. So social support isn't just a nice little bonus to have. It is literally the fuel for the engine of recovery. To kind of step back and humanize these academic findings, let's look at a quote from patient advocate Diane Hadijan. She powerfully reminds us that when you have the right support engine in place, this profound adversity can actually lead to some really unexpected personal growth. She notes how priorities suddenly get clarified and you start becoming deeply appreciative of things you probably once took for granted. She says, some people even say that there is a silver lining to breast cancer. I think that just perfectly captures the very resilience this data points to. And finally, Section 5, Thriving Beyond Treatment. But let's bring this all together and synthesize these sources into some actionable takeaways, both for patients and for their support networks. Based on the research, thriving doesn't just happen, it requires intentional action. Survivors can actively construct that engine of resiliency we've been talking about. First, building strong community and family social networks is absolutely paramount, as we just saw the data prove. Second, seeking out specialized trauma education to help navigate the really tricky emotional complexities of survivorship. Third, engaging in regular physical exercise. This has been proven over and over to improve mood and combat that lingering fatigue. And finally, practicing mindfulness or leaning into spirituality to really maintain that hope and mental clarity.
I want to wrap up this explainer by asking you to reflect on everything we've looked at today. We now know the math, right? Social support creates hope, and that hope creates a better quality of life. The clinical stage doesn't dictate a survivor's happiness. Their community does. So I want to leave you with this one thought. How will you step up to be the social support that fuels the unseen engine of resilience for the survivors in your own community? Think about it. Thank you so much for exploring this vital topic with me today.